For the treatment of a fractured elbow, the first provider will stabilize the injured extremity. The second provider will assess circulation, motor, and sensory.
All right, we have pulse. Move your fingers for me. And which finger am I touching? Index.
If it is not already exposed, the provider should expose the injury site. The next step is to attempt to place the arm in the position of function, which is at a 90-degree angle. You should not move the arm, or you should stop movement if it causes increased pain for the patient or if crepitus is heard or felt. Since the provider was able to take the arm to a 90-degree angle, the arm will be splinted in this position of function. A board splint will need to be selected that will extend diagonally 2 inches or more beyond the upper arm, as close to the shoulder as possible, and 2 inches or so beyond the forearm, just proximal to the wrist. 2 cravats should be draped over the center of the board, and then the board will lay on top of the arm, padded side to the patient from the wrist to the shoulder. The 4 tails of the cravat should be inside the bend of the elbow. Take both tails of the cravat closest to the wrist, bring them straight down toward the wrist, and then up over the board and tie a knot. It is important to make sure that the cravat is snug. Next, the provider will move to the upper cravat, take both tails, bring it under the arm on top of the boards, and tie a knot. To take out any slack that may be in the cravats, the provider will take one tail, run it through the loop created in the same cravat, and then take it back to the other tail and tie it. The same thing will be repeated with the second cravat. This patient will require a narrow sling and a narrow swath. The provider will lay a narrow sling across the uninjured side of the patient's chest. The arm will be placed across the chest on top of the cravat. The tail will come around the arm, tying the knot on the uninjured side of the patient. If there's room, the knot can be slid down so that it's more on the patient's chest, just below the clavicle, which will eliminate the need for padding. If it is tied on the neck, a pad must be placed under the knot. A narrow swath will also be applied. It is important to make sure that the swath does not hit the elbow. At this point, circulation, motor, and sensory will be reassessed.